In our region, colon cancer is rising. 7 out of every 10 patients are being found only in late stage of the colon cancer. What is the implication of this in our society? We are getting it late when it is not practically possible to intervene very much. The good news, there is a test that can prevent this entirely. Unfortunately, most people think this is an old person's test. The real issue, this is costing us real lives. So, what can we do to revert this? Picture a small growth in your colon. It has been sitting there quietly for years in your colon. The colon is a tube. A small growth could be a polyp. That outgrowth in that colon, it may sit in your colon for 10 years. And within that time, what was a benign polyp could progressively turn to cancerous. This is if it is left alone, it becomes cancerous over time. If it is found during a colonoscopy, then it becomes nothing. And in the same sitting that the colonoscopy is being done, you can comfortably remove the polyp and life continues uninterrupted. What could be a cancer 10 years down the line, when you remove it 10 years before, life remains uninterrupted. In our region, this is what we need. Nobody is going for the colonoscopy to find the polyp before it becomes an issue. And this is where the problem is. Why does doing a colonoscopy matter? Major health regulating bodies have recommended starting your colonoscopy at 45. And you may need to do it earlier if you have a family member who has had colon cancer before the age of 60. This is a study that was done in northern Tanzania, and it has shown that colon cancer has increased 6 times what we expected. And 4 of 10 cases were found in people under 50 years. Back here in our country, Kenya, there is a study that was done in Kilifi County, and found that very few of the cancer colon patients survived for 5 years. The main reason, 70 to 80% of the people diagnosed with colon cancer were diagnosed very late. This is in our country, Kenya, and the problem is accelerating. Prevention is not just the detection. A colonoscopy removes the polyp during the same procedure that finds the polyp. And this is linked to 83% drop in colorectal cancer. And there was an 89% drop in cancer from colon cancer when you screen on time. So you are not only catching the cancer early, you are preventing it even from starting. Why is age 45 the new starting line? If there is no family history of colon cancer, then 45 is okay. And the good news, a colonoscopy you only do after 10 years if you have normal results. So you have 10 years of peace. But most of the rural regions in Kenya, nobody does colonoscopy, and the patients are diagnosed or made to do a colonoscopy because of the presence of symptoms. Meaning the entire pre-symptom screening we do that protects people elsewhere in the world is completely missed out in our setup. So we need to change our practices. We need to understand that colon cancer screening is an important screening test. And it is for both male and female. The incidence of colon cancer in our region has raised significantly. The main drivers are increased in body mass, obesity, decreased fiber intake, and all these are contributing to higher risk of colon cancer. When joined with low and late presentation because of symptoms, then we have a disaster. When you have a family history of colon cancer, then you need to start screening early as 40. But if you have a family member who have had colon cancer below the age of 60, have a discussion with your health provider on when you should do a colonoscopy. And the good news is that the colonoscopy now are easily available and they can be done with a lot of comfort. If you need one, you can visit the Wellness Health Services Health Medical Center in Machakos and we will do a colonoscopy for you. There's a procedure for preparation which will be given to you, and then you prepare it and you have the colonoscopy done. So if you are 45 or older and you have not done a colonoscopy, don't wait for symptoms. Don't wait for more days. Don't wait for the appropriate time. This is the time to do it. Come and do a colonoscopy. If a close family member had a colon cancer less than 60 years, start at 40. Don't wait for pain, for bleeding, for weight loss. By then, the disease is already very advanced. Talk to your family members. Know about your history. Know what risk runs in your family, which cancers run in your family, and take the necessary precautions. Colorectal cancer is rising, and it is being caught too late in our region. A colonoscopy done at the right time can prevent the cancer and remove the suspicious polyp. And this is when we can catch the cancer, prevent it, and treat it before it starts. The only cancer that is easy to treat is the one that has not happened. If you are 45, you have not had this conversation with your doctor, make it your task, non-negotiable, this week. Comment colon 45 if you are going to have this discussion. I will send you the screening guide and the preparation schedule. Your body whispers before it screams. Listen early. Visit the Wellness Health Services Medical Center for a colonoscopy today. We meet in the next video.